The regenerative medicine, it's really a myth or hope for the hopeless couples or the person. Hello everyone, good evening. Here I am in Salabi, the heart of Dubai. You can see in the background, it's on the Sky Tower, 54th floor, with the two wonderful ladies, the beautiful lady. They're our brand manager as well as a partner for regenerative medicine activities, what we are doing. Here today we are going to talk about the regenerative medicine. It's really a myth or hope for the hopeless couples or the person, because I'm not going to give you today's the overview about the fertility management, but overview how it helps, because most of the time the concern about the regenerative medicine for the people, what exactly it is. Sometimes we misunderstand, like regenerative medicine means only a stem cell therapy. See, as the name signifies, regenerative medicine, definitely something is going to regenerate. The principle of regenerative medicine is not on the symptoms. It works on the restoration, repairing, rejuvenation, revive, reclaim, restoration, rejuvenation, revitalization. This is what does it mean, regenerative. That means something you need to rediscover the generation. This is what the regenerative medicine exactly. And it encompasses with many branches. It has the huge applications. It's the future of the medicine. This is going to transform the healthcare technologies as well as procedures to the medical doctors and the scientists, those who are working to advancing the human health with biotechnologies. Basically, if you'll see, stem cells from the fertilization, from the 2 days of embryo and to the complete adult human, each and every cells have capacity to divide more than 200 kind of the cells. So one of the branch, it encompasses stem cell therapy. I'll talk very much details in my next overview about stem cells. Then another is cell-based therapy, like you might have heard about the platelet-rich plasma, amniotic membrane, hyaluronic acid, etc. Then another area is energy-based devices or the medical devices, which brings the functional changes like laser, many kind of lasers, CO2, erbium YAG, ND-YAG, 1470 like the diode laser, then radio frequency, high intensity focused ultrasound. These all like an energy-based devices which works to enhance the function as well as the appearance. Another part is the regenerative compounds, many biomolecules like granulocyte colony stimulating factors, which accelerate the process of healing cascade of the body. When any cells and tissue got damaged into the body, our own body cells accelerate for the regenerations. This is how regenerative compound helps. And many other advances like tissue engineering, like you need the scaffold for repairing the non-healing ulcer, diabetic foot, orthopedic indication like full thickness articular cartilage damage, like a sports person, young person having osteochondral desiccants. You cannot do the knee replacement in the 18-year of the person. You need some of the alternative medicine to manage their knees. And those who are diabetic, those who are reluctant, don't want to do the knee replacement, in that case, tissue engineering based scaffold like autologous chondrocyte implantation and many advanced technologies comes into this area of the medicine. And another part of this is the genome editing tools and the molecular medicine. So this is what encompassed with the regenerative medicine as a branch. Currently, many advances come apart from the cancers, because most of the time when we see regenerative medicine or stem cell technology, we think about it has the applications as a bone marrow transplant for cancers, leukemia or hematological conditions like aplastic anemia, sickle cell anemia, etc. But nowadays these signs are growing. Many non-hematopoietic indications are coming, autologous, minimally manipulated, homologous, same-sitting surgery. These kind of indications are applicable for non-hematopoietic indications. to manage the symptoms, to manage the conditions of the patients, especially in our centers, like we are managing with fertility problem, those who tried multiple times IVF, IUI, or those who are looking only option they are left with the adoption or the donor egg, like in case of premature ovarian failure or their endometrial thickness are very poor, very low, the indication called thin endometrium or recurrent implant failure or Esserman syndrome. In that case, patient own peripheral blood or the bone marrow aspirated concentrate taken by the hematologist or pathologist or orthopedic surgeon, then the stem cell scientist prepare the cells into the lab and injected by the gynecologist or the laparoscopic surgeon into the ovary for premature ovarian failure or amenorrhea, or the women who got the early menopause in their 30s, or the poor endometrial lining. This kind of indication are very much hopeful with this kind of technologies. So looking forward to see you. Be tuned with us to learn about these topics. I'm bringing the series of knowledge for all of you. Watch complete video, participate in our quiz. If you'll get good rank in the quiz, we are offering you the lifetime membership of IASRM, International Association of Stem Cell and Regenerative Medicine. It will enhance your career as well as you will learn many advances about regenerative medicine based technologies. Thank you very much. And again, we are here at Selabi, Dubai.